The name of this project is the Journey Home, and it was named by a community member here in the West SÁNEĆ Nation. And we've been working together for about 3 years. Staff from the Sandwich Peninsula Hospital, with Island Health, and community members from the 4 nations, Paquachin, Sakem, Sartlup, and Sayout.
It's something that we have never ever really done within our communities, is to teach or to train people how to be with our First Nations people at their time when they're going to leave us. I thank you for being here and wanting to learn our ways, our First Nations ways of how we care for our people.
The kernel of this Journey Home project really began with Maggie and I feeling like we weren't with people in the same way with the WSÁNEĆ Nations as we were with non-Indigenous people in our community. We just were aware of that. Lucia was, of course, one of the strongest voices saying, we do this, we know how to do this. We've been doing this for generations and generations, and you know, we don't need you to come in and teach us how to do this.
The Journey Home project is fairly new, and I remember one elder telling us that we even changed the way that we die now. You know, there's structure to the way that we die. And sitting back and absorbing just that statement, it made sense. And seeing the professionals who are becoming more aware and wanting to meet the needs of our people when it is the end of life. We start to prepare, and we try to do the best that we can, but along the way there's some hard lessons that we learn, and sometimes we're offending each other. Sometimes we could be overstepping boundaries, but how do we know what those boundaries are if we're not sharing? So that's why we're coming together for this group.
My 2 biggest hopes are, one, that all non-Indigenous island health people will learn how to support better ways, more culturally safe ways of supporting all of you in the communities when you want to be caring for your families at home. And then I hope that all of you in the communities will come away from this with more confidence and more understanding of how you can keep people at home.
This room is filled with so much knowledge and thoughts and values and so much good things where if we could see it in the spirit, we'd be so thankful that we're privileged to be here today.
Going back to that beginning was you, Jane, as the Aboriginal nurse, saying to me, well, there's an elder in hospital right now, why don't we talk to him? Amongst the very first things that he said to us was, know our history, know what happened in Canada. For me, as a non-Indigenous palliative care physician, that was a pivotal moment. And it has shaped the training. It was the front end of the training for any non-Indigenous participant was to experience the history through the blanket exercise, through various ways we've tried to build so-called cultural competency in caregiving, which is about knowing the history of relationship between Indigenous and non-Indigenous peoples in our country. It's not just a First Nation story, it's all of our story.
I think the biggest thing that we are scrambling to work in our communities is for who we are, First Nations people, because we're still getting mistreated in some of the hospitals.
Like I knew some of the history, but I didn't realize how much I didn't know until coming here. And the blanket exercise was sort of more emotional. It was like being there in a way.
It was really powerful. It hit me emotionally, spiritually. You learned a lot. Like, I was so exhausted after, but in such a good way. And it was such a good way to begin this learning process.
That really kind of started it for me. And if opportunities are made available thereafter, somebody who was really impacted by that may decide, you know what, I need to figure out more, I need to learn more.
I do see a lot of First Nations patients, and I just have more sense of awareness of the trauma that they experienced, and it's easier to understand.
You know, I heard that we need to learn about First Nations history, but really this is our history.
One of the biggest things was just the relationship building that's taken place through this and the networking that's taken place through this. And so I think that it opens up the conversation and there's just a better knowing and understanding of one another.
In the 3 years we've been working, we've got to know each other really well. And I think that we're a strong working group. We listen well to each other and respect each other and learn from each other. That learning from each other is sort of what the base, I think, of these 6 half days of learning is that the medical people will hopefully have some education and information that will be helpful to caregivers in the community. And then all of you in the community have all of your culture and traditions at end of life, all your stories to share with us, the non-Indigenous people. And it's just so important. It's such an important two-way learning. That's what this is about. It's not about us, you know, Island Health trying to teach you anything, right? This is us wanting to learn.
This has been another beautiful circle of co-learning together. I really appreciate learning about Western medicine and hearing from professionals in medical science and everything that we need to learn as we become ill and as we age. But then it's so beautiful to hear from all the caregivers as well in the community, hearing about their experiences and all the knowledge in this room. And once again, I'd like to say that this room is so filled with so much knowledge and wisdom. It's so good for me as an elder to witness that.
If I want to help our elders and help my family, we need to share. And I need to share everything that revolves around our life that we have in our reserves and amongst ourselves. We need to share that they got to know who we are as Sinchafan people, or Saanich people, or saltwater people. So I really appreciate you taking the time to learn about our culture and to learn about who we are.
This is a very unique process where we're co-learning, and no knowledge is less or more important than another. It's how do we bring the two together and learn each other's ways in a good way.
Building the relationships and taking this time to be together and learning, really true, deep learning is the only way that we can really impact and make a difference and a change.
Looking forward to building that relationship with each one of you.
I want to thank you all for being here to learn, to understand. We work out in the communities and you guys come into our communities. It's good when we're all united to learn with an open heart.
And that's what makes me feel really good. And seeing each one of us all working as one and doing it for our elders also. Everybody in our community.
From here, we all hope to learn to work together better. It goes both ways. We just got to work at working together better. That's what I'm here for.
It's meeting in the middle. It's about coming together. We're getting stronger with that network. We're getting more knowledgeable about First Nations bands and adult care and who does what, and the nurses, the nurse practitioners. And when we leave on the last day, that we're a bigger and we're a stronger team, because this road goes both ways.
We're here today and then the other days because we're all quite curious. And I think I would agree that is a really important way to address these types of conversations or talks, because we really just don't know. There's different people, different families, different cultures, different values. We've heard about how different experiences can be, so the curiosity, the asking permission, trying to get to know who is this person, right? The beauty of being here is we get to learn, and then it helps us move forward and have some of these difficult conversations.
It's just so that you can understand better how we cope with the end of time, how it is to treat the First Nations, how to be able to understand.
One of the things that has come up for some of the people taking the training is that they're relearning their own history and their own teachings around what palliative care may have looked like for their ancestors, their grandparents, and how First Nations communities would have naturally cared for their people at home. And so some of those stories were able to come out, and some of those stories are now going to be able to be shared as well, not only with non-First Nations healthcare providers, but also with the communities. And Lucia put it best when she said that it gives an opportunity to archive and to renew those teachings for community caregivers.
There's so many different teachings and not every family or community is the same. So it's just being able to remain humble and observe what's happening around a situation.
Whether it be our culture or anybody else's culture, our loved ones come for them. They're in the room, we can't see them, but in the end, our loved ones are so vulnerable. And it's like the newborn, they're pure again. Everything's open to them. And we all, as one people, know that our loved ones have experienced. Somebody's in here, we can't see them, but you feel the energy.
But we know it's because that they're being prepared for passing over. One of the things that my mother had said was when I went to visit her, because I was there every day when she was in the hospital, and she says, I saw on that wall there, I saw a canoe coming and it had a man and a woman in it. And so for her, that was just a message that, yeah, pretty soon you'll be, they're coming and they'll take you. You know, that's part of, I guess preparing them for that time to come. So they're not really afraid, they're prepared. So don't think they're crazy when they're hallucinating.
Yeah.
It's just something that happens.
When my mom, when she left, while she was in palliative care, she was laying there and she was on morphine, and she was going like this. She kept going like that, and she was knitting. She was knitting, and she was moving all the, and she was doing the stitches, and then when she passed on, and in the dream, she came to me and she said she's teaching all the young girls on the other side how to knit sweaters. And she was already doing it the day before she left.
They're not delirious, they're not having withdrawals from pain, pills or anything. They're actually having visitors that are coming from the other side to prepare them for their journey to the other side before they leave us. I've had numerous clients say, oh, so there's my wife, and I have to acknowledge the wife that I don't see. And they say, oh, and they say, oh yeah, she's okay, you know, like, but the actual them speaking and talking with their visitors is when I start to see the family start to panic, or other caregivers start to panic, because then it's really settling into their mind that it's getting close for them now because they're having these visions are more frequent.
Many of your community members raised that brought forward their stories of how you view what we might call delirium or confusion or restlessness from a different lens, a lens of connecting with their ancestors or getting close to passing. So those are the things that our doctors and that we need to understand and respect and honor, so that a different choice may be made with what to do with that.
My sister stays at home with her small kids, and that's usually cautioned for kids not to be around too, so that was a reason for my mom to stay at the hospital.
And my experience when my father passed away, my daughter was 8 years old, and I was told not to hug her or touch her. God, that was difficult. It was because she needed me.
My family, both sides, they cared for her at the home. When they're ready to die, they wanted to go to the hospital. They didn't want their last memory of their kids to be having pain in the home, or they didn't want their spirit to be kind of sort of wandering in the home.
In our way, you know, a lot of us have big families, small families, and we all have different values, cultures, and beliefs.
Each person knows their role in their home when someone is passing. My role was to make sure that I notified one person to do all the calling. I was the cook, one person to stay up at night, things like that. We each have our role in our families.
Just like in Western medicine, everybody has their job to do, and that's who we call upon. It's not really something that we've written down in books. It's something that we just know in our hearts who does an excellent job in this line of work at the end of life.
It's not because we know better, it's because we were taught this when we were small. We were taught how to take care of our loved ones when they're dying.
We do everything natural. It just comes to us. It's not written.
One of the leaders of the family will call for spiritual support.
We use a lot of prayers, you know, prayers to allow our loved one to go on their journey.
Our beautiful loved ones that have passed on have gone on to a beautiful place, because that's how we believe as Native people. It wasn't the end, it was like a new beginning.
There is life after death in our communities. We feed our loved ones that are gone. We give them clothes when they're gone. We burn them for them. There's indicators when we know that they're hungry. There's indicators when they need something. They come to visit us.
That life is continuing, and that's what our people always have had, I believe. That life continues on after this.
It doesn't end. Our bodies stay here, but our soul and our spirit lives on.
We always have the family meeting, the community meeting, the prayers, and the service. And in every one of those, it's always expressed to us by the speaker. You know, he always thanks the family and friends who have come to support the family. So it's always put out there in the open that we care about the family.
You know, we just try comfort them the best that we can and move the work to where it has to go. And that's gathering at their family's home.
We've always, you know, helped in any way we can. We've always kind of donated and helped with the expenses so the family doesn't have a hardship. It's common in our communities. It's taught to us. This is the way we need to support each other.
And I think our people still do. In the best way, help one another. Right from the 9 wall down and collect money from house to house to help the families through these times. Because it's a costly thing these days to be able to bury your loved ones. I really have to admire the working together of our people in that situation, because it's helped many, many people to be able to put their loved ones to rest in a good way.
I'd really like to welcome Sadie and Anna, and they are going to talk about traditional medicines. And
Children are the best medicine for the elderly. So I just want to make sure that that is understood, that we worship our children, if you want to call it that. We protect them, we love them, and we guide them along. You take the whole stem, leaves, the stem and the berries, you boil it, and then you bathe in it. You make sure you bathe your whole self, because when I touched a coffin down at the church to help carry the person in, because there wasn't enough people to help carry the coffin in, I was told by an elder to get this and bathe in it. Well, I did, but I didn't do my whole self. When I came here, my nieces came running to give me a hug as usual, and they pulled back and they started to cry because they could see the death on me. For stinging nettle, I heard stories about our elders, like when they had arthritis in the back, that they would go to the creek and grab a handful and do this around the back, whatever they can do. And that would just heal that pain in their back of their neck. This is also a cleansing when you're wanting to get brushed off for your spiritual and emotional healings.
How do we make people comfortable when they are in the hospital? How do we help these families so that they feel comfortable being here and that we feel comfortable that we are giving them the care that they need while they are here? As a community health nurse who on the other side would be addressing people at home, feeling like, how do I meet those needs of the client and the family in the community? And so it was really clear to me that I also needed some training and some tools so that I could help people stay at home if that's what their wishes were.
As people get more and more sick and get closer to journeying home, change is inevitable, and what we need to do to respond to symptoms is always changing.
So some of the reasons we see people coming in are the caregiver burnout, the pain, nausea, those kinds of symptoms. Also changes in mobility if they're needing to use an overhead lift. And also the people who have the potential for a crisis at end of life. They're often in the hospital. So those are the things we see.
I work in the community as a nurse, and so spend a lot of time advocating and helping families to keep their loved ones at home. I think what I see as some of the most anxious times for people are when mobility changes, and there's maybe some falls that lead to calls to the ambulance. when there's the realization that they're not going to be able to get to the bathroom or the commode on their own, and the care changes, the nursing changes to being in bed. It's a very anxious time for families. Lots of questioning whether or not they're doing the right thing. Maybe they're trying to fulfill someone's wish to stay home, and it's very difficult then.
For me, what I've seen as the biggest reason why people end up coming into the hospital from home at the end of life is because the family just don't feel supported enough. You know, they're either burned out from caregiving, or they don't know who to call, or, you know, it's just too much.
One of the things we do in palliative care, though, is we try to manage symptoms if we can, so that people can go home. So get that pain under control, get that nausea under control, and then they are able to be at home.
How and when would be the best time and the best approach to talk to somebody about what their wishes would be, you know, near the end of their life? Can you give me some advice and some counseling on how I could approach somebody if I needed to say, you know, it might be a good idea at some point to consider what your wishes would be when you get near the life, what type of care would you like, and what are your overall wishes without causing distress and offense to the family.
In the process of working in the communities is the go-to persons and using their resources, and it's so helpful for community members or family members also to be included in all that and being recognized. So that is part of your learning community.
A lot of our people tell our homemakers what they want and haven't told the family, so it makes it hard sometimes. So it's easier if the person finds out that they are in a condition that they're not going to get better, it's better for them for the doctor and the nurses to meet with the family and explain to them what's happening so that they can prepare themselves.
When you say not everybody wants to die at home, some don't want to die at home because they don't want their grandchildren to see them. Is there more that you could say about that?
We have the nurse arrange for the doctor and the family to get together with the client and explain things and find out what that person's wishes are when they reach different stages of life. Some of them are very private and they don't want anybody to see them in the last days of their lives, and so they prefer no visitors. And some will tell you, I have to see so-and-so before I go, and then they tell you, I don't want so-and-so in the room with me when I die, and that. It makes it a lot easier if they do go through that stage, because it's you find out what the person wants, and it's easier for them to accept it as they go along.
I think it has to be the family choice of where they want to die. I think that our families, both sides of the family, they want to be cared for at home till they're ready to go. And because the hospital has a little bit more extended care for the needs that they might have, but also because they don't want us to have that last memory of them suffering in the home.
When you go into a home or even into the palliative care unit, you're overwhelmed by the number of people that are there. We all like to sit together when a person is very sick or in their last stages of life. We sit together to support each other.
And the hospital situation, when our people are in the hospital, within the hospitals, and I think that for the most part, Sandwich Peninsula Hospital has been very good with our people and giving them the space that they need. But in some places, it's more difficult to be able to have that privacy of family together, of big families coming and going. That's our families are.
Perhaps when that person has been to the doctor and needs interpretation then they need to perhaps go to see somebody in the medical field in our communities to help them go through what was said to them in with the doctor.
Not only that they might not understand the clinical language, that our people are very humble and they don't complain. They don't like to express the bad things that are happening to their body.
Our people are so shy. You know, they don't want to share things, or they don't know how to ask questions.
And they don't always have a lot of time with those specialists. Like, it could be really quick, and the system is overwhelmed already. We're finding that it just seems like everywhere we go, the medical system is overwhelmed.
Because we have already heard many times in the course of this Journey Home project that words like end of life or terminal are not comfortable for your communities. They're not how you think about this journey. And so that actually was the origins of why the project is called Journey Home.
There's a Sinchothan name for a person that's ready to go home. There's a fine line between death and living. And they prepare themselves mentally, emotionally, physically, and spiritually.
And that's what we say, they left us behind with people that are very, very sick. Oh, and they say you can't see, they have no more life in their eyes. You know, and you can see that their spirit is already starting to leave them. And they're experiencing some of this, those ones that are sick. Of course, it's always a very sad part of our lives when we losing our loved ones. And everybody really, they're very tender or kaka in their feelings or that because of those ones that are leaving us behind. Our way of living and believing in life is that we have sacred parts of these things. And those days that we call Anschacha, your sacred time, when your loved ones are leaving you like that. It's your sacred days. It's the sacred days for yourself and your family that are going through this. Until that burial is taking place, that's when that's all done.
So we do have Sinchothan names that go with these different steps. And I really think it's there for us to be more accepting of the next stage in our life.
I guess today we're going to talk about grieving. It brings up a lot of feelings when someone is dying or when someone has passed. How do we support each other when we are grieving? When we lose our loved ones, it's like a 5-day process with us. They pass away. We have our community meetings to give all the information for the funeral. There's so many preparations, and a lot of people come in and help us with that part.
One thing I remember is having a lot of people come and even just sit and have coffee or have breakfast with us or have a meal with us or just visit.
And not necessarily say anything, but be just present and just allow the natural cry to come.
I agree, just being present, and for me what comes up is not being afraid, I guess, to be there. So I know I feel nervous if I'm going to sit with someone, just I guess with words to say, or so just being present, not being afraid.
When I was going through grieving also too, and then I've had a lot of friends and family and stuff that came and sat with me, and someone just
came and just went like this to me. And at that time, I felt like I was just like right down, but with that gentle touch, and I felt like it just uplifted my spirit a little bit, you know, it felt like strength and just embraced me with love.
I think we need to be supportive as can be, and you can tell by their appearance if they want you to hug or hold them, or just sit and be quiet beside them. Ask them if they need anything, because they don't want to bother anybody, but if we ask, sometimes they'll let us know. So just be supportive as can be. Sometimes just sit quietly with them is all they want.
How we have conversations with people who are dying. Just the way in which you see that, in terms of how to have those conversations that are supportive.
They want to be validated on their fears. They want you to hear them. I would sit there and get us a cup of tea and let them tell me what were they scared of.
Just being there for the person who's dying. Just being there, listening to them, how they feel, what they want for their kids. Because the people who we work with was mostly elders, and it's just listening to their own stories of life growing up, what they went through, and just being the ear, listening to them.
What kind of thoughts go through your mind when a loved one is passing?
Adult care was bringing in what they call palliative counseling, and it was a workshop, and it was just like 2 days of just walking through grieving. We have a working system that gets us through where we have to do to be able to care for that next one that next day. It's just teamwork. We might gather, we have a meeting, and we might debrief, because if that person has been in our community for 90 plus years, and we looked after them for 15, you know, it affects all of us in a different way. We all have compassion, we cry, we hurt.
We believe that workers that work on the front lines, they carry a lot of heaviness. Ladies that work in the caregiving profession, they carry a lot of sadness, especially when they lose their clients. And that's what us elders do. We have a physical prayer and brush away some of that heaviness. And then you go out from that room feeling a little bit lighter, feeling a little bit more ready to face your day. Each one of our elders have a different special way of having their physical prayer for you.
We like to allow whatever the family needs to do. If they need to sit there and have a party, that's fine. That happens. If they need to sit there and be quiet, that's fine. And we encourage them to bring in lots of their friends to visit if they wish. It's just whatever the family wishes for their loved one. It's really, a lot of it is the care of the family left behind. It's not the person who's going is going, and I believe also they're going to somewhere better. I think it's the family left behind and how to process that loss.
I believe that some of the things that our communities do is really for us, the ones that are left behind, because of the letting go is part of our culture of being able to, that whole week following the death, it's letting go together, making sure we surround each other, making sure that family is protected, because their mind isn't always there. And it looks like the non-Native community is doing that as well, but we just might do it a little bit differently, and in our journey home.
When we go through our grieving process is to prepare us. I think it's more meant for us than it is for the ones that we've lost, to be more accepting of death. This is how we conduct ourselves, that we have to follow from the day that she or he's gone until we've completed our grieving process. They prepare us. I think the process that we go through, these different protocols, the different teachings, the different families, the different protocols within the families, they're all different. But we do have workers. We do have workers. I'll go to my niece, Cornelia's sister, because she's got a special teaching, that I will go to her and ask her to do this because that's her job. We just don't ask anybody because he or she is trained in that department.
Our ways of looking at is to take care of ourselves within the first year. You know, if looking after our own family and loved ones, and maybe give off some little sacrifices that we want to give up something to be able to remember that person.
Once again, I'm just so thankful for what I've witnessed, but it's going to be all these ideas are going to come together and be tweaked up. There's so much good ideas out there from our people. There's so much of our Native community members that have excellent ideas for end of life that they have practiced in the many years of losing loved ones.
We're looking at creating a place where all of this is written down together for a patient so that it's crystal clear who you call in the middle of the night or who you call at 8 o'clock when things are changing. So we don't have some of these same barriers as we had historically, that we should be able to do good anticipatory care and you know, build a care plan for the vast majority of situations.
We're trying to design a circle of care with the idea of a mapping the journey on the back of it. So a patient-held card that has all of us on it, including all the Indigenous healthcare partners, but also people, traditions, how this person is unique in a unique family, in a unique community, and how do we capture that and understand who they are and ask about it at least. So it's thinking about that working together and working as an advocate in these situations with our First Nations partners.
Having elders present when you are having big conversations with families, having big meetings, because there is such differences among all families, and if that is something that is wanted, it would be nice to encourage and reach out for that earlier rather than later. So I think that was something that I thought was a really useful thing, was to remember the resources that families have within their own communities, as well as, you know, having the nurse practitioners from the various health units come to discussions as well, like just creating that team and net much more purposefully.
What the starting group did, and what we have done, is we have developed trust.
For me, I think that this group, that's the strong point for us, is the relationships that we formed with the people in the Indigenous communities, the elders that we've got to know. That's been a profound change in my life. Some of the times I've spent with them since we last met, it's been wonderful. It's really in the relationship that things are going to change, and I think it starts with each of us.
I feel like if we're going to pass on what we've learned, it would be kind of important for people to have it hit home as much as it hit home for me.
We
need to kind of take the onus on each of us individually as well. So although this is a Journey Home project surrounded by palliative care, it will go beyond, and the partnerships and the learnings that we have occurred will also go to other healthcare. But I think that a lot of things that by kind of reflecting inwards can also be extended to just general daily life.
It's been really good. Our hearts are becoming united as one. Even though the group changes, we are still learning how to work together, and great things will happen, maybe not right away, but over a period of time as we listen to one another and put the pieces together, it's going to be something great. Maybe I won't even see it, but in the end it's going to be something great for our babies.
You have enough knowledge now when you leave here and go into the hospital. We have provided you over these days how we would like to be cared for. Again, do not speak above us, speak to us.
Well, I don't know how that's going to come about, but I believe before it's all finalized, however it's done in a booklet form or however it's going to work, I think we have to have a little bit of patience too, not bring things together too quick, because there's so much that can be put into it. What we've got here is really a room full of knowledgeable people, but as some people might get tired of me praying for wisdom from the mighty Creator, is so that we use our knowledge and mix it up with some wisdom to know when to speak, when not to speak, what to do, what decisions to make every day of our lives. And I believe too that this is something that we can't really rush into, because there's so much knowledge out there that needs to be brought in.